Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the drugs causing congenital birth defects, also called teratogenic drugs. First of all, let us know what is a teratogen. A teratogen is any agent that can produce a congenital anomaly. Any agent means not only drug, maybe environment, maybe exposure to radiation, even exposure to sun, exposure to certain type of food, some type of chemical that can produce congenital anomaly is called a teratogen. What is critical period of teratogenic insult? The critical period of teratogenic insult is 2nd to 8th week of pregnancy, also called embryonic period, or the first trimester of pregnancy. But you have to remember that many drugs are teratogenic during any time of pregnancy. Even some drug may cause congenital birth defect in the late term of the pregnancy. But the most critical period for many drugs is between 8th and 2nd to 8th week of pregnancy. During the first trimester of pregnancy, this is the most critical period. The embryonic period is very important because there is rapid cell divisions, differentiation of the cell, organogenesis happens during this time. Certain drugs are absolutely contraindicated in pregnancy. These drugs are called category X drugs. They are absolutely contraindicated. Certain drugs have evidence of risk to the fetus. They are called category D drugs. This category is provided by FDA, Food and Drug Administration. It varies from time to time. It also varies from country to country. So let's start. Drug causing congenital birth defect, teratogenic drug, category X drug. There are many drugs. The list is not limited to this. We may increase the number of the category X drug according to FDA and the rule of the policy of the health policy of the country where we study. This is the drug thalidomide. It's a very important drug. It was used as an anti-nausea sleeping pill, especially to manage morning sickness in West Germany in the late 50s, also in Australia. So it is found that a lot of baby born whose mother took thalidomide during first trimester of pregnancy, a lot of them has no limb. A lot of them have no limb. We call it amelia, or miniature form of the limb, we call it meromelia, or abnormal shape of the small limb, we call it phocomelia. It may involve all four limbs. So the number of the babies with limb defect were increased after taking the thalidomide, that is a sleeping pill, hypnotic, anti-nausea pill, specially useful for morning sickness. So then in 1961, this drug was prohibited, restricted to use during pregnancy. But this drug is still in our market. It has many other uses like that of management of multiple myeloma, management of systemic lupus erythematosus, even management of leprosy. Sometimes this drug is still prescribed, but it is absolutely contraindicated during pregnancy. So the thalidomide effect is not only confined to the limb. Baby born may have heart problem, may problem in the intestine, may problem in the kidney, maybe multiple anomaly together in a baby whose mom took thalidomide during pregnancy. We have many other drugs here. All of them are category X drug, like phenytoin. There is an anti-epileptic drug. Oral contraceptive may lead to a lot of anomalies like bacterial, vertebral, anal canal. Okay, so limb defect, many defect may happen together. RU466 drug, like that, radioactive iodine. This is the statin group drug, HMG coenzyme A. Hormones, dihydroergotamine. Okay, so this all. Alcohol is an absolute contraindication during pregnancy. Even small amount of alcohol may lead to congenital birth defect. It can lead to fetal alcohol syndrome. Okay, so it varies from person to person, but no amount is free from teratogenic insult. Live attenuated vaccine should be avoided during pregnancy because of this category X drug group. So many more drugs, we may increase the number according to FDA, and the policy of the particular country. Okay, here we are saying very common, this is the fetal alcohol syndrome. What are the features of fetal alcohol syndrome? Why this happened? Fetal alcohol syndrome happened because mom took the alcohol during first trimester of pregnancy. Again, we have to say a lot of drug, teratogenic insult is not confined to the first trimester of pregnancy. So second, third trimester of pregnancy may also cause teratogenic insult if someone is taking some type of drug. But first trimester of pregnancy is the most critical period for teratogenic insult. Here, fetal alcohol syndrome, if you look at the appearance, thin upper lip, shallow philtrum, okay. We may have epicanthal fold, and if we look at that, short palpebral fissure, this is a short palpebral fissure of the, and flat nasal bridge, short nose. This fetal alcohol syndrome baby has also heart anomaly like atrial septal defect, ventricular septal defect. Other anomaly is also possible along with this. Okay, here fetal hydantoin syndrome. Mom took anti-epileptic drug during pregnancy. We have different type of facial appearance, low IQ, and there is changes in the digits. Okay, so like that. Fetal hydantoin syndrome is a young girl. She has learning disability, low IQ. Low IQ is also found in case of fetal alcohol syndrome. Also, you get microcephaly, head may be small. Here also low IQ. Okay, here, and there will be hypertelorism. The distance between two eye is more than normal. Here also epicanthal fold. We may also get epicanthal fold in fetal alcohol syndrome. Okay, so we got that. Right hand of the girl with severe digit hypoplasia, short finger, born to a mother who took phenytoin throughout her pregnancy. It should be taken because phenytoin is a drug of choice for management of epilepsy, and 1% population of the world has epilepsy. Half of the world population are female. So to maintain the health and to avoid epileptic fit, person should take phenytoin, but along with phenytoin, she should take big source of folic acid so that could prevent some of the complication of phenytoin, some of the teratogenic insult of the phenytoin according to the doctor's advice. Okay, so we got that. So this is the fetal hydantoin syndrome. This is the fetal alcohol syndrome. We'll get many more syndrome due to the drug during pregnancy. Mom took the drug during pregnancy. Previously, before the teratogenic drug list, we had ideas that the congenital birth defect is only hereditary. No, it is not hereditary. Environment is a very big factor. Drug, exposure to radiation, extreme temperature, all may lead to congenital birth defect. Okay, like this thalidomide. Okay, like fetal alcohol syndrome, like the fetal hydantoin syndrome. Okay, we got that. Now we are here. Category D drug, definitive evidence of risk to the fetus. We have list here. We may increase the list according to FDA or the health policy of particular country, like tetracycline. Tetracycline is an antibiotic, streptomycin. Tetracycline may cause discoloration of the teeth, permanent discoloration of the teeth, permanent damage to the bone. Okay, and this discoloration is not limited to the deciduous teeth. This discoloration will be permanent to the permanent teeth. Okay, streptomycin is a anti-TB drug. Okay, the amikacin, tobramycin will get. These all drugs are the aminoglycoside. They may have adverse effect. Streptomycin may lead to congenital deafness. Okay, like that. And many drugs, like everything may cause problem. Valproic acid, anti-epileptic drug, it may lead to congenital birth defect. And a person, if have only one birth defect, it is in many cases associated with many other birth defect, maybe 2, 3, 4, 5, 6 birth defect. The same baby is possible. Okay. Lithium is a drug used in bipolar disorder. It may cause congenital heart defect. We call Epstein anomaly. Epstein anomaly. Okay. Norepinephrine during third trimester of pregnancy may cause huge problem. So not necessarily during the first trimester of pregnancy, because brain develop throughout the pregnancy, even after birth. So exposure to the teratogenic drug even after birth may lead to birth defects. Hydrochlorothiazide is a diuretic. It may lead to congenital heart defect. So these are the category D, definitive evidence of risk to the fetus drug. And that's all about the drugs causing congenital birth defect, also called teratogenic drugs. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.